I'm a pediatrician, and I was for many years in a hospital setting and then in a private practice where I saw many children get sick with diseases like measles, like meningitis, like chickenpox. And when I became a mother, I couldn't wait for my children, who are now 14 and 9, to get immunized.
My name is Sandy Close. I'm the Director of New America Media. Very honored once again to partner with the Centers for Disease Control and Prevention on this very important topic of public health, and in particular also the Chicago Department of Public Health Immunization Program and the Chicago Area Immunization Campaign, bringing vital information on the issue of immunizations, especially infant immunizations. Today's forum is all about protecting children, all of our children. How we as media can inform our audiences, especially parents, about why vaccinating their children is so important, about the dangers of not immunizing children, and what action parents can do to ensure their kids are fully protected through immunization. Joining us are national and local experts in this field, and you have extensive bios for each speaker in your folders, but let me briefly introduce them to you. Dr. Andrew Kroger is a medical officer for the National Center for Immunization and Respiratory Diseases of the Centers for Disease Control and Prevention. He's a frequent speaker on topics ranging from immunization updates to pandemic influenza preparedness. And he is also author of the newest edition of the CDC's General Recommendations on Immunization. Thank you, Dr. Kroger. Dr. Julie Morita, Medical Director of Chicago's Department of Public Health Immunization Program. She's a board-certified pediatrician who directs programs to increase immunization coverage levels among children, adolescents, and adults in Chicago. Thank you, Dr. Morita, for being here with us again. Lisa Kritz is the director of the Chicago Area Immunization Campaign, a project of the Illinois Maternal and Child Health Coalition. The immunization campaign began 20 years ago to bring together the public and private sectors to promote the delivery of safe, effective, and timely immunizations. And Ms. Kritz has worked with the immunization campaign since its inception. And finally, Dr. Daniel Perez, who is a pediatrician with 20 years experience in pediatric behavior and development, mental health, and nutritional childhood problems. He started his medical practice in his native Peru. He's worked with premier Chicago providers at Lutheran General, at Cook County Hospital, and in Chicago's Little Village area. So what a distinguished panel we have. We're going to start first with Dr. Kroger, and each of our speakers will have 7 to 10 minutes. At the conclusion of the presentations, we're going to encourage Q&As, and at the conclusion of the Q&As, we're going to have time for one-on-one interviews. We've already done a few. So, Dr. Kroger, thank you.
Great. Thank you very much, Sandy. So I'm Dr. Andrew Kroger from the Centers for Disease Control and Prevention, and I bring good news about childhood immunization. Parents and healthcare providers are doing a great job in protecting their kids and communities with vaccines. And I'd like to give a bit of background into the importance of vaccination, talk about a very specific public health vaccination example, and then discuss what we all can do as a community to further improve our success with vaccination. So first, a bit of background. Vaccines are among the most successful and cost-effective public health interventions that we have for preventing disease and death. For all the babies born in a given year, vaccines will prevent 20 million cases of disease and save 42,000 lives, and additionally will save $13.6 billion in medical costs. Through safe and effective immunization, we can now protect infants and children from 14 childhood illnesses. These are illnesses like measles, whooping cough, meningitis, all before the age of 2 years. These are diseases that once harmed or killed many infants, children, and adults, and also led to complications such as brain damage and deafness. Now, when we look nationally, immunization coverage among children 19 through 35 months of age is high and in many cases is increasing. CDC's 2010 National Immunization Survey shows 73% of children 19 through 35 months receiving the full series of infant and toddler vaccines. And when you look at our immunization coverage for 4 of our vaccines, specifically the polio vaccine, the measles, mumps, rubella, or MMR vaccine, the hepatitis B vaccine, and the chickenpox vaccine, we're at or above our national goal of 90% coverage for those vaccines. Now, I want to mention there's been a great deal of interest over the past few years on the parents that didn't vaccinate their children or sought exemptions from vaccine requirements. And good news is that our recent national survey shows that this number is relatively low. Less than 1% of toddlers received 0 or no vaccines at all. So we're doing a great job. Nationally, we are reassured because this means that more parents are protecting their young children from diseases that cause widespread and sometimes severe harm. Now, I want to take a moment to congratulate and perhaps maybe steal a little bit of thunder from Chicago's Department of Health. In 2012, Chicago received an award for having the most improved immunization coverage, and this is looking at a time span between 2007 and the 2010-2011 season. For the recommended vaccines, for routinely recommended vaccines, Chicago improved its rates from 61% to 74% during this 3-year period. So that's a tremendous increase. The vaccines we're talking about are 4 doses of DTaP, that's the diphtheria, tetanus, and acellular pertussis vaccine, 3 doses of polio vaccine, 1 dose of MMR vaccine, 3 doses of the hepatitis B vaccine, 1 dose of the varicella vaccine, and 4 or more doses of the pneumococcal conjugate vaccine, or PCV vaccine, which can prevent meningitis. So Chicago is really to be congratulated for achieving this goal of immunization coverage. Excellent job. I do want to conclude by talking about some of the work that still needs to be done and things that we all can do. I mentioned that we had received or that we have reached our benchmark of 90% for certain vaccines, such as the measles, mumps, rubella vaccine, the MMR vaccine. Well, if we're at 90% for that vaccine, it means that 10% are not receiving that vaccine. That's 1 in 10 children that is not receiving protection against measles, mumps, and rubella. There are 13,000 children born every day. They need to be protected. They need to be protected before their 2nd birthday. We need to recommend and administer vaccines at the point in time when children are at most risk from the diseases or the complications, and that's before the age of 2 for most of these vaccine-preventable diseases. These diseases still exist. They're still out there. Recent outbreaks of measles and whooping cough have shown this. In 2011, there were 222 confirmed cases of measles in the United States, more than any other year since 1996. You may remember the clusters of outbreaks that occurred in 2008, 2009. Well, in 2011, we've had more cases. We had more cases than that year. 222 confirmed cases. The European Union is experiencing a major outbreak of measles, more than 30,000 cases in 2011. And we all know that these vaccine-preventable diseases are only a plane ride away. Other vaccine-preventable diseases such as whooping cough do occur in the tens of thousands of cases, more than 27,000 cases of whooping cough reported in 2010. This can be a fatal disease, especially for infants. There were 27 deaths in 2010, and 25 of those deaths were in children younger than a year of age. And also, you may have heard that in Washington State, last week, whooping cough cases reached epidemic levels there, 640 cases in 23 counties in Washington State as of March 31st. So this puts Washington on a pace to have the highest number of reported cases in their state in decades. So it's very important that all of us, healthcare providers, members of community groups, state and local immunization programs, parents, assure that children are protected from vaccine-preventable diseases. And some of the ways that we can do that is promoting immunization. We're here this month because during the week of April 21st through 28th, we will all join together to celebrate National Infant Immunization Week, or NIIW. This is a national celebration that draws attention to the importance of infant immunization, highlights the positive impact of vaccination on the lives of infants and children. This will be our 18th NIIW celebration. It occurs annually. This year we're celebrating it as part of a World Immunization Week that's organized by the World Health Organization. And as typical, NIIW is going to be held in conjunction with the Pan American Health Organization's Vaccination Week in the Americas. So this is a great opportunity to remind parents about the importance of timely vaccination. We have to make sure these vaccines are given by the time the child is 2 years of age. CDC is launching new tools and materials to help increase awareness of vaccine-preventable diseases and the benefits of vaccination. This includes a mass media campaign, print ads, radio, television, public service announcements in both English and Spanish. We've also launched a new website designed just for parents at www.cdc.gov/vaccines/parents. So please join me in encouraging parents to continue to be the champions of their child's health. Let's encourage parents, not just for National Infant Immunization Week, but all year round, to check the child's immunization record, schedule a visit with your child's doctor, and make sure that they are up to date on their vaccines. It sounds so simple, right? But it's something we can all do to ensure that our children have the best protection available for the 14 vaccine-preventable diseases that are still with us. So I will conclude there, and thank you very much.
Thank you, Dr. Kroger. It sounds like we are now about to hear from Dr. Julie Morita, who deserves, with the Department of Chicago Public Health, a great deal of credit for this. Dr. Morita.
Good morning. Thank you for coming. As Dr. Kroger mentioned, we are here together because we're in anticipation of National Infant Immunization Week, which is later this month, April 21st through 28th. And in Chicago here, we look at National Infant Immunization Week as an opportunity to celebrate the successes of our immunization efforts. But it's also an important reminder for the ongoing need for public health, the medical community, and our partners like the media to really promote immunizations and to educate the public about the importance of immunizing infants on time before the age of 2 years, and to assure that immunizations are accessible to everyone, infants, adolescents, adults. As Dr. Kroger and Sandy mentioned earlier, in 2012, the Chicago Department of Public Health received an award for having the most improved preschool immunization coverage levels in urban areas. So since 2007, our coverage levels increased from 60.6% to 74.2%. So it was a significant improvement in our coverage levels, and we're really pleased about that. However, although our coverage levels are among the highest we've ever had, and most vaccine-preventable diseases are rare, we really can't let our guard down, and we look at NIIW as an opportunity to really remember this. that we still have diseases that are circulating, and they do present a threat to us all, especially young infants. In 2011, there were 3 Illinois residents who were infected with measles. And just a few years earlier, there was a large outbreak of measles that resulted in 32 cases occurring in Illinois as well. So these diseases still occur, and they still are a threat to our young infants. Although the numbers may seem low, one case of measles can lead to many more people getting sick. So we have to remember that it's a serious disease that's very easily transmitted to other people. In addition to measles, for the past 2 years, more than 1,000 pertussis or whooping cough cases have occurred in the state of Illinois. And about 1/3 of these infections occurred among children younger than 7 years of age. So young people, young children, young infants are getting ill. The other thing to keep in mind regarding the threat of diseases is that even though our young children and our infants are well immunized, every day in Chicago, more than 120 infants and babies are born. And in the state of Illinois, over 300 infants are born. So there's constantly a need for us to keep those messages out there about the importance of immunization and vaccinating on time. This year's National Infant Immunization Week theme, Immunization Power to Protect, is an important message because it aims to empower parents as well as healthcare providers to do the right thing and to get their infants immunized on time before the age of 2 years. Before I stop, I do want to acknowledge the award that we received. The Chicago Department of Public Health received the award. However, we can't take full credit for this. I think we have many partners in the city of Chicago, and the media is one of them. Your ability to communicate to parents and to share important information with them helps us to get these infants and children immunized on time. In addition to that, the Chicago Department of Public Health has worked with the Chicago Area Immunization Campaign, the state chapter of the American Academy of Pediatrics, to really focus our efforts on educating healthcare providers about the need for immunization and the need to promote immunizations, as well as to informing and educating the public. Throughout the year, we provide immunization trainings for doctors in doctor offices, in hospitals. We also go to community groups and present information to parents and family members. In addition to that, the health department itself distributes over 1 million doses of childhood vaccines throughout the city of Chicago to doctor offices. In addition to our usual activities during NIIW this year, we will be reminding healthcare providers to administer all vaccines that are recommended to all infants. We'll also be present in WIC centers where people come to get nutrition vouchers, food vouchers, so that we can remind the parents that are coming there about the importance of immunizations and the safety of immunizations. And then we'll also be making sure that our vaccines are available in those settings, not just to educate, but also to provide the vaccines. And in addition, the health department has a Facebook account, a Twitter account, and our website where we'll be sharing more information about the importance of immunization and on-time immunization for young children and infants. So I'd like to stop now, but I want to thank you all for this opportunity so that we could actually describe some of our successes, some of what we perceive as ongoing challenges in terms of the diseases and the threats, and then also to remind you and have you help us to remind parents about the importance of immunizing young infants before the age of 2. Thank you.
Thank you, Dr. Marita. Now Lisa Fritz with the Chicago Area Immunization Campaign.
Hi, thank you for coming. I just wanted to tell you a little bit about the Chicago Area Immunization Campaign and then talk about a couple of our projects that are going on and then talk about what we're doing for National Infant Immunization Week. And I do want to stress, one of the things I want to stress about the campaign is that we'd like to serve as a resource for the media. We house a lot of immunization resources and data that we'd be happy to share with you, and we work very, very closely with the Illinois chapter of the American Academy of Pediatrics and the Chicago Department of Public Health. We're really quite a team, and it's worked out very well. As was stated before, we started in 1991 in response to the measles outbreak. And at that point it was found that the 0 to 3 population in Chicago had an immunization rate of about 30%, and as you see now, we are over 70%. 74%, however you want to count it, over 70%. And as Dr. Morita said, that came from a lot of hard work. And I just also want to reiterate that we can't let up on our hard work. I saw rates go from 30% to 70% through a lot of hard work, but as has been pointed out, babies are born every day, so we have to continue in that work. So the goal of the Chicago Area Immunization Campaign is to prevent disease in the Chicago area and raise immunization rates by promoting the delivery of safe and effective and timely immunizations. So with that goal in mind, we conduct a number of activities, one of which is we have a data analyst on our staff who is constantly looking at immunization data, and again, we'd be happy to share anything we have with you. We also provide community immunization education training, and that is where we are trying to educate staff people in the community on the importance of immunization so that they will convey this to their clients. We also provide community outreach concerning infant immunization, and we have two staff people, two outreach workers that go into pocket of need areas and literally give out information on immunizations at laundromats, at beauty parlors, at places where the community residents are hanging out and getting this information. We also work with the state of Illinois on their immunization registry, and we have a flu project with the Chicago Department of Public Health where we coordinate 8 flu clinics in faith-based organizations during flu season. We have a newsletter. We have general meetings 3 times a year where we try to bring relevant issues to our membership, which is over 100 of public and private entities. We have a public awareness committee where we're constantly thinking of campaigns to get out there into the community. And we have a project going on right now called Protecting Our Infants from Pertussis, which I'm going to actually talk about next. So because of the rise in cases in Illinois, as we saw over 1,000 cases, and this is coming from 600 in 2007, and I think it was like about 133 in 2000. And some of this can be due to better reporting, but we do know that there is an increase. So we decided to take on pertussis as a whole and kind of reach out to all of the entities that need to be reached out on pertussis. So one of the things that we're doing is trying to reach out to the infant population and make sure that they're getting their 4 infant pertussis shots, and we are using the campaign "You're Not Done at Age 1," so to make sure that the parents are continuing to take their kids to the provider, because the 4th DTaP is between 15 and 18 months, and we see a drop off slowly as the shots go on. So we're trying to improve that, and that also affects some other shots as well. Then there's the concept of cocooning, which is a very important concept, which is infants can't get their first immunization against pertussis until they're 2 months old. So we need a way to protect infants, and they're not fully protected until 18 months, and then there's a booster at 4 to 6 months. But so we're really trying to figure out how to protect those infants, and the best way is to have the adults around them protected. So it's an interesting component that we also have to work with adults on an infant issue. And so we are working to get the news out to OBGYNs, because pregnant women can be immunized with a Tdap against pertussis. We are trying to work with internists, emergency room physicians, and birthing hospitals to make sure that the word is out that if you are going to have contact with an infant, you need to be protected and get the Tdap. We are also going to spread the word that there's a new school requirement for 11-year-olds to get a Tdap. So we will be working with the Chicago Public Schools on getting that word out. So that's what we're doing with pertussis. And again, it's a strong partnership between us and the Chicago Department of Public Health and the Illinois chapter of the American Academies and the Illinois State Medical Society. The next thing that I wanted to talk about that's really helping us with our battle on infant immunizations is something called Text for Baby. And this is a texting program that was developed by a national organization called Healthy Mothers, Healthy Babies. And it is for pregnant women and infants up to 1 year. And you text in a number, and you get free text messages throughout your pregnancy and the first year of your child's life. Everything from nutrition, and good eating habits, but it also includes immunization messages. And one of the beautiful things about this is because of the higher rates we're seeing in Illinois with pertussis, we just were selected as one of 7 states to get an extra message concerning pertussis. And it just goes to show how a program like Text for Baby can so quickly get out the message. We're at over 14,000 enrollees in Illinois. We have the 6th greatest number in the nation of enrollees. And the Chicago Area Immunization Campaign and the Illinois Maternal and Child Health Coalition are the lead agency in Chicago to get the word out. But we are pleased to say that the Chicago Department of Public Health just put out posters in the L's in our trains that you may have seen. And that's just a wonderful outreach tool. And so we are making major progress with that, and I encourage that to get the word out to all of your readers. Lastly, I just wanted to talk about what we're doing for National Infant Immunization Week. We are partnering with the Chicago Department of Public Health. They are going to put out vans throughout the week of NIIW to give out Tdaps. And our group, the Chicago Area Immunization Campaign, is going to provide the community-based outreach to get folks to those vans. And we are going to provide outreach in a 10-block radius of all the vans. I think the schedule is in your packets, and we're very excited about that opportunity because we'll be, it's another fight against pertussis. And then we are going to be disseminating palm cards that are going to say who you can call to find providers of infant immunizations, and it'll provide the infant immunization schedule. And those cards, we're producing 20,000 cards, and those are going to be disseminated through our outreach workers through pocket of need areas. So with that, I will turn it over to Dr. Perez.
Dr. Perez, our last speaker.
Oh, thanks, Sandy. I'm very thrilled to be in this roundtable to share my experience as a frontline provider and providing vaccines to the Hispanic community. I have worked as a pediatrician doing primary care in the last 12 years in the Hispanic community. And during that time, I think I have become to know very familiar with the characteristic of this community. I believe the community I serve, the Hispanic community, puts a strong emphasis on vaccines. This is more evident when there are new vaccines and they come to us looking for more information. This cannot be overemphasized because there is still a lot of misinformation around, and we providers need to be a resource for our patients and parents and families at all times. One thing I could tell about the Hispanic community is that, in general, I think this is true, they are very accepting of vaccines and the role of protecting their children, to a point that sometimes they believe that this is one of the few reasons to bring the children to their pediatricians is that when they get a shot, when they're sick. I think that's a mixed blessing because for us it makes it a little bit more difficult to explain that we do some other things other than vaccines and what to explain the other service that we provide. I'm not complaining though, but because it makes the parents bring the children to their offices for the shots, and that's very important to us. We healthcare providers play a critical role on helping parents make the decisions to vaccinate their children. As there is a lot of misinformation around, parents, because of their idiosyncratic characteristics, they tend to look up to the providers for information and their recommendation, and this is what they want from us, and we should provide that information at all times. I have found that when talking to parents about vaccines, it's helpful to helping understand that the vaccines has a preventive role, and try to relate it to some things that they can understand, because as many parents, they haven't seen firsthand these diseases, so they don't have an understanding of why are we vaccinating. But once they understand that this is for prevention, And most importantly, that these are recommendations of the providers. They tend to accept readily the vaccine recommendations that we provide on their preventive visits. Talking on the barriers that we have seen, personally that I have seen during the time that I have been practicing in this community, what I could see or I had observed was that parents cannot complete the recommended vaccination schedule. One of the reasons are, I will say, is socioeconomic reasons, because there are parents that work long hours, so both parents work and they don't have the time to bring their children to their office. And because of the recent economic downturn, some of them, they have lost jobs, and because of that, they had to move to a different addresses, so they changed phone numbers. And it's difficult for us to reach them to remind them of their vaccine or their visits. We have tried to overcome this barrier by establishing an active case management from the medical home. Most recently, many families, again, for the economic downturn, have lost their insurance coverage, or most of their plans don't cover vaccines. It's ironic, but I think I have the impression that patients or parents who have insurance coverage, they tend to complete their immunization less likely than those who have public health plans like Medicaid. I always found that interesting, because you will tend to think that they will be better off, but it seems to me, in my experience at least, that's not the case. I think this underscores the problem of inadequate vaccine reimbursement. And I think in this regard, the AAP has been playing an active role in advocating better reimbursement rates for providers for the last years with some very success. On another side, I've observed that in the last few years, exactly since 2006, with the Medicaid healthcare environment change, that has allowed us providers to establish a more effective medical home model, which allows us to have a defined panel of patients that we can manage actively. This has allowed to establish a partnership, true partnership with parents and families, to make sure that they come and they comply with their visits. And this partnership has worked, I believe, to the bettering of the immunization coverage rates, at least in my practice. Just to illustrate a point, I have observed that since 2006, my rates were in the low 60s, and now they're in the high 70s. I believe that's because of the ability for us to reach them, because we know them, we establish a partnership with them, and this allows us to make them comply with their visits, and this has worked pretty good for us. Now, from my point of view as a frontline provider, this improvement has much to do with having the possibility to establish this relationship as a true partnership, with the responsibility of me as a provider to provide the quality of care, access, and coordination of care, and expecting from the parents the responsibility to comply with their visits. And this, I believe, is what's at the core of a true partnership. Now, just to finalize, I believe that parents and pediatricians are partners in protecting the child, the health of their children. And the American Academy of Pediatrics and the healthcare community strongly believe that childhood immunization form a foundation for a lifetime of wellness and health. And the best way parents can and doctors can protect young children is to ensure that they're fully immunized by age 2. With that, I finish my presentation.
Thank you. It's really now very important for us to share questions from our audiences, from the audiences we serve. What are the questions that you think your audiences would have of this distinguished panel around this subject of infant immunization? Who would like to go first? Surely one person. I know that one key question is, and you alluded to this, Dr. Paris, that you were surprised that the people with private health insurance might be less apt to actually follow through on the scheduled immunization than people who are receiving Medicaid, who are part of a health home. In other words, could you talk a little more about that?
Sure. It has been my observation that when I see a patient that comes with a private insurance, they tend to be more under-immunized than patients who are under Medicaid. And I believe the reason for that is several. One of them, I would say, is the lack of proper reimbursement rates for vaccines. The other one will be the lack of establishing a public or medical home model, because patients with insurance, they are not bound to any provider. They can go to any provider, and that makes for a loss of continuity of care. And some providers might vaccinate well than others, and then at the end of the patient is the one who doesn't get all the vaccines.
Could we ask, especially Dr. Kroger and then our Chicago Department of Public Health experts, what are you seeing in terms of disparities in vaccination? Where are the sort of pockets of need greatest?
I can start a bit. I can start a bit about what we know about disparities in coverage rates with respect to ability to pay. We see this somewhat for certain vaccines, the DTaP vaccine, the Hib vaccine. We see some discrepancy. I think we've made some strides in improving that discrepancy over the years. You have to tease out the difference between ability to pay and the issue of race and ethnicity. And so when you break those two apart, we do see some residual difference in terms of poverty. It's 67% coverage versus 72% coverage, if you want to look at the numbers. That doesn't go against the point, though, that Dr. Perez was making about the fact that someone that ironically might be in the system might go to see different providers. This has to be studied more, whether the continuity of care generally might affect one aspect of care, immunization coverage. That there might be something to that as well. That makes sense. So I could see it both ways.
It's almost as if the trusted healthcare provider who is constantly communicating the message is very effective. If somebody is going to different providers, maybe the message isn't quite as consistent.
Right.
Dr. Morita, what's your sense of where the pockets of need in Chicago are most evident?
Well, I guess before I do that, I wanted to kind of continue what you were just talking about, the issue of healthcare provider recommendation and the trusted source of information. I think there's a growing body of evidence to support the concept that parents like to hear the messages and are more likely to get their children immunized if they get a recommendation from a healthcare provider, because the healthcare provider is a trusted source of information for them. And so I think what Dr. Perez was describing in terms of this relationship between the parents and the providers is really an important key in terms of getting these children immunized. And I think one of the things that has happened since the early 90s, when the Vaccines for Children program was developed, it's a federal entitlement program where free vaccines are available to children who are uninsured or who are on Medicaid or who are Native American or Alaskan Native. All those children can get vaccines through a doctor's office at no charge to them. And so I think that's a very important program that's allowed us to decrease some of the disparities that we've seen, whether it's socioeconomic or whether it's racial and ethnic. We've seen that those gaps are narrowing because the vaccines are readily available to all children regardless of insurance. And it may be, like Dr. Perez is saying, is there are some insurance plans that don't cover vaccines 100%, and those children may not have as great access as children who have Medicaid or uninsured because of this federal program. So I think that there's healthcare provider relationship is very important in terms of conveying the importance of vaccines to the parents so that they're more likely to accept and understand. And then the other thing is that this Vaccines for Children program has really been an important program in terms of narrowing racial and ethnic and socioeconomic disparities in immunization coverage. And over time, over the past 12 years that I've been here in Chicago, we've seen that disparity narrow. And so in the past, we really focused a lot on trying to get Hispanic and African American children immunized. More recent data has showed that the gap has really narrowed. And so our focus really is on getting all children younger than 2 years of age immunized on time when the vaccines are recommended.
Ms. Fritz.
I would reiterate what Dr. Morita said as far as the disparities lessening, and I think in part it is also due to the fact that we have been concentrating in those areas, for the past 16 years, and that they've always been a high priority. There's still a slight discrepancy. According to the 2010 National Infant Immunization Survey, the immunization rate for blacks is 66.9%, white is 69.9%, and Hispanic is 72%. So there's a 3% discrepancy. We are narrowing the gap, but there is still a gap that needs to be addressed.
Don't let me keep you from asking your questions, but yes.
I'd be interested in hearing what parts of Chicago are these pockets of needs that you've been sending volunteers out to, and are the most at risk from that?
So several years ago, the Chicago Department of Public Health was able to access Chicago public school immunization records. So when children go into school, they have to provide an immunization record. And so we were at kindergarten entry, 6th grade and also 9th grade. We looked at the kindergartners and looked back to when they were 2 years of age to see how well immunized they were. And we mapped out their coverage levels based on where they lived. And so we identified about 12 different communities within the city of Chicago, and most of which were primarily African American or Hispanic. And those are the 12 communities that we've tried to focus a lot of our efforts on in the past. Unfortunately, we haven't been able to get access to that immunization data from Chicago Public Schools until recently. We just got access again, and so we're hoping to look again and see what progress has been made. The national or the citywide data that we have suggests that our coverage levels are improving, and the estimates the CDC gave us for racial and ethnic disparities indicate that it's improving as well, but we'd like to see what the local data shows to really assure that. So there are some pockets on the south side of Chicago and the west side of Chicago that we're really focusing our efforts.
I'm sorry.
Well, I have the communities, and I think CDPH has the communities, so if you want to contact, if you want to take my card and call me, I can get it for you when I'm at the office.
The vans that you talked about going out in National Infant Immunization Week, there's a schedule of where those vans are going to be?
The schedule for the van is we have a van that works throughout the city of Chicago on an ongoing basis. They do some adult immunization, some adolescent immunization, as well as infant immunizations. This particular week, because it's National Infant Immunization Week, we will be focusing our efforts on WIC sites and places where young children and young infants will be. And so the schedule is included in the packets that all the attendees have.
One of the dramatic points that you have made is that the immunization, vaccination has been the historic breakthrough in public health in the 20th century, and that we forget the illnesses that were so threatening 70, 80 years ago that aren't around anymore. We don't think about them. Dr. Kroger and maybe Dr. Perez, especially with your international experiences, what are the diseases we're really preventing? We think of polio, but meningitis. I almost don't know myself what are the great forces this vaccination immunization program is protecting us from.
As far as the diseases you've mentioned, I think meningitis, measles, and pertussis are the big ones we've talked about today and are notable for several reasons. Meningitis, we have a new type of vaccine that works really well to prevent infection with bacterial meningitis. It's a particular kind of meningitis caused by several different types of bacteria. The pneumococcal conjugate vaccine is one such vaccine. The meningococcal conjugate vaccine, granted we use that for adolescents, but for infants and toddlers, the pneumococcal conjugate vaccine is relatively new, was licensed in 2000, works extremely well in reducing meningitis caused by this bacterium. So that's one that we still, we still might be seeing cases of it, but with more and more use of this vaccine, it may become a disease like measles, where we don't really, see it except in an outbreak situation. And I've mentioned measles. Measles, has a case fatality rate of 0.2%. That's, one death for 500 cases. This is a deadly disease. We are very concerned about measles. It can cause pneumonia, can cause encephalitis. But again, it's one of those diseases that, because of the success of vaccination, we haven't seen it very much anymore. We don't see it much anymore, but we know that it still can occur, and so that just emphasizes the need to vaccinate. And then, of course, pertussis, which is an as yet uncontrolled whooping cough disease that is particularly problematic because of its severity in infants who have not received the full infant series of vaccines. Again, 0.2 case fatality rate, 1 in 500 cases will die, typically due to whether it's encephalopathy due to seizures or pneumonia. But again, and that is a disease that is as yet uncontrolled, but we're working on this. I'll pass it on.
You didn't ask me to talk, but I'm going to talk anyway. So Andrew mentioned it earlier that measles has been imported. Many of the cases that have occurred last year in 2011 were brought in from other countries. Travelers from the U.S. who went abroad weren't protected and brought it back into the United States. And I think that that's really an important concept, because the countries from which these diseases came were not the developing world. I think everybody likes to think that we only bring bad diseases back to the United States when we're traveling to the developing world. But these people were coming back from Europe, Western Europe, and they were bringing in measles. And I think that what the message, a really important message is for people that are traveling internationally, is that their babies, if they're traveling with infants that are 6 to 12 months of age, that they should actually get a measles vaccine before they travel. Because that vaccine won't really count for the full series. They'll still need to get another dose at a year and another dose at least a month later. But that they may have some protection while they're traveling and there's disease that's present. Because in the Western Europe, in France, in Switzerland, they're having outbreaks of measles, and people are going to those countries feeling like they're safe. But they need to get the vaccine with their young infants.
Inevitably, one has to ask why in Europe. Why are you seeing that in Europe?
I mean, there has been some vaccine hesitancy among parents in terms of them not seeking the vaccine or not wanting to get their children vaccinated. So when we don't vaccinate and we have large pockets of people that are unprotected, diseases recur and epidemics occur.
And you use the phrase that you're a plane ride away. That's a kind of soundbite. Could you say just a little more about that?
Well, I think because Chicago has O'Hare Airport, which is an international hub, every year we have people that are traveling to and from, well, every day we have thousands of people that are traveling to and from the developing and the undeveloped and the developed world. And so I think we just have to keep our guard up. We can't assume that we're safe. We need to vaccinate everybody, and especially these young infants who are more likely to get seriously ill. They need to be vaccinated.
You had asked about what diseases the vaccines prevent, and I have the list of the 14 diseases if you want them, but I want to give a shout out for rotavirus, because that rotavirus, the doctors can, it's diarrhea. Okay, but my daughter had it at 8 months, and this is not something you want your kid to have, and we know it has drastically reduced the number of hospitalizations by leaps and bounds. So it's another one that that's something people here have probably seen, and we are so lucky to have a vaccine now that can fight it. I know a number of people who were in the hospital with their infants with that.
And Dr. Perez?
Well, I could tell you from my experience when I was working in Peru in the 1980s, they were still doing active surveillance for polio. I think the last case of polio in Peru, where I come from, was in the mid-'80s, and it's considered eradicated since then. But polio is not eradicated from all over the world, as it can be reported. I think it's still very prevalent in Africa, very prevalent in India. And for me to see hesitancy about vaccines, I think underscores the success of the vaccines that has allowed us to to the people, to get down their guard, say, well, we don't see this disease, so why do we need the vaccines? And this, unfortunately, doesn't happen in my community because they are very accepting of doctor recommendation. But if you move to other communities where there is more information and misinformation and parents are more educated, paradoxically, the hesitancy tends to be bigger of a problem.
Thank you. That's really a provocative idea that maybe the more you know, or the more you think you know, the more exposed your child may be. I'd like to ask the media here, what do you think your own hesitation is around immunization issues, around the idea of immunizing your child or your sister's child or your nieces, your nephews? What are some of the factors that might give pause to getting your infant immunized? Remember, if I'm correct, that it's 74% immunization, complete scheduled immunization. That still leaves quite a large number of infants who are not immunized, right? So we have to really, is it just sort of lack of somebody reminding you time goes quickly, you have a lot of work to do, you think your kid is going to be okay? What do we need to tell our audiences about why this has to be a priority?
I think one of the things to think about is that we look at coverage levels when children are less than 3, and the reason that we're looking to see how well immunized at that time is because they're more vulnerable, they're at more risk for getting seriously ill. So we definitely want them to be immunized before they're 3 or before they're 2. But I think we know that most children get immunized by the time that they go to school because parents will often wait until the children start school. Not often, but some parents will wait until the children are required to get the vaccines for school entry. But our message really is that that's just a backup safety net system. The message really is that babies need to be immunized on time according to schedule before they're 2, because that's when they're most vulnerable and when they're more likely to get ill. So I think that's a really important message to get out there. Yeah, some parents will wait until they're older, but that's really, by that time they may have made it through this vulnerable period. They're lucky they didn't get sick and get hospitalized or die with one of these vaccine preventable diseases.
I'm going to just ask one more question, and it's really asked from the standpoint of as a journalist, remembering how all of us sat and listened to the presentations in California, many different parts of the country about vaccines. What sticks in my mind is a human story. It's a story of a woman who did not get her infant immunized for pertussis. And she stood in front of us and told us about watching her infant die. And I think there wasn't a single person in the room who wasn't crying, including myself, listening to this woman tell her story. So when we were in Nevada last week, one of the journalists said, I'm trying to absorb the data, I'm trying to absorb the statistics, but what I would love to give my media audience, he was Chinese, is a human story, a story of somebody who really understood through personal experience, or that you perhaps witnessed, something that really drove home the power of vaccines to bring wellness. You said a foundation of wellness for life when people have had childhood immunization. Could each of you tell us a story?
Well, we have a family that works closely with the Chicago Area Immunization Campaign in Deerfield, which is a suburb of Chicago, where her infant contracted pertussis at 3 weeks old, too young to be immunized, and the mother had had a slight cough before giving birth. Well, the infant did get pertussis and coughed so hard from the pertussis that she is now 7 years old and has cerebral palsy because of the brain damage due to the coughing. And that family is always happy to talk to the press about the life that they live now and what they went through. So if anybody would like to contact that family, I'd be happy to give that information.
Thank you. And anybody else on this sort of human face of this issue? And that's partly because that's what we do best.
Sure.
Well, I think I had to recall my experience from when I was in Peru, when I've seen, lots of cases of rotaviruses, the diarrhea. Peru has, just took an illustration of, has a 50% rate of malnutrition. And diarrhea and malnutrition, they go close together. And when I come to this country and I see that there is a vaccine that can prevent that, I see that I can prevent a case that might go and end up in the hospital or have a childhood malnutrition that has a long-lasting effect on the child. So I have seen cases of pertussis. Fortunately, they did end up in this country. They end up bad because it was detected early on because of the awareness, thanks to the campaigns of the different organizations to diagnose this condition. But I'm sure that there has been worse outcomes than that. That's what I could share.
Last questions. I have one last question, and that is, why are we seeing the outbreak in Washington? The state of Washington. Is there any?
It's an excellent question. It's early in this, with what we're seeing right now, the increase in the number of cases, and I think I'm going to have to some degree, turf that to our direct CDC line so that you can be put in touch with the specialists that deal directly with cases. And to the extent of whether this is even clustering, it's unclear to me how it's clustering or whether these are, sporadic cases that Washington is seeing. That's one issue. Sometimes we see these things in discrete outbreaks, and then there are case counts as well. And the issue taken more broadly as well as to why we are seeing recurrence of pertussis or why it's an uncontrolled disease. We have learned in the last 10 years that pertussis can occur in outbreaks in adolescence, that they can spread pertussis. I don't know if this is what's happening. I'm talking generally now in terms of pertussis. I'm not referring specifically to Washington anymore. So we know that they can spread disease to the infants and those most vulnerable. So the age spectrum of pertussis has changed, I would say, in the last 10 years for whom we know can spread this disease. It can spread in households. We don't know yet with certainty whether household crowding affects pertussis spread or not, but it's one of the things we're thinking of in terms of a reason for why it occurs. So that's some things we're learning, but we're still learning a lot about pertussis.
And these outbreaks remind us of how vulnerable we remain to these illnesses. But Chicago, very positive success stories so far. Let me just go around the room. Any question or any observation? Part of this is also because the CDC and the Public Health Department are anxious to get input from us on what we think some of the issues are in our communities.
Well, what I have heard in the Hispanic community is that sometimes parents are kind of reluctant to take the kids because they might get sick after they get the
Very good point.
This one, and other is why they are so painful. You have these kids, little kids, monthly, so
Scared of the shock.
The shock, and then the leg too. So they have this, I don't know when I can hold a claw or sometimes, like a bruise. Sometimes they can they do it less painful?
So So for the first question about reluctance for children to receive it because they're afraid of getting sick. So I'll emphasize first that, of course, vaccines are used to prevent illness from the vaccine-preventable disease. So they are given when a child is well and healthy in order to prevent disease in the future. And because of that, vaccines are held to an extremely high threshold of safety, meaning we take great measures to make sure that vaccines are safe, simply for the reason that they are given to people that are perfectly healthy. They're an intervention that we give to a healthy person. So vaccines are first they're studied in research facilities, but then they have to go through an extensive development process, at the end of which they're finally licensed after being studied in tens of thousands of individuals. And that's all before they get licensed. And then even after they're licensed, and this is by the Food and Drug Administration, we continue, because we know they're going to continue to be given post-licensure, to study the safety of these vaccines. In fact, vaccines are continually being monitored and observed just to make sure that they are in fact safe. And so no other intervention, I don't think, is held to as high a standard of safety as vaccines are. There are some side effects that we know are going to happen, right? And one of those is our local reactions. And we see local reactions pretty much with all of the vaccines. So they're very common. They go away usually. They're typically mild. They go away by themselves with no need for any type of intervention after 2 or 3 days. So it is something that we do expect to see, and we continue to recommend vaccines after local reactions can occur. And we try to, as far as the site of where we give a dose, where we recommend a dose of vaccine, we do try to move as children develop to walking and becoming ambulatory. We try to switch the preferred site to the shoulder as opposed to the leg. So we do make that recommendation as children begin to walk and become. It gets to that issue of having enough muscle mass in the shoulder versus the leg. The leg has a bigger muscle mass, but we do expect to see these local reactions, but they typically they go away on their own and are quite mild.
Those are very important points to highlight. What about you?
Well, I am many other newspaper, and I've also done a lot of reporting on diabetes and the diabetes community. And what I've noticed is that, especially among the Latino community, there's a lot of myths, and I'm sure Dr. Fleitas, you understand. So is there anything being done to try and break down those myths, those cultural barriers, and speaking to these ethnic communities in a way that they understand?
One of the things that there are resources and information regarding things that parents can do before a child gets immunized to help to minimize the pain. Because vaccines, you inject a needle into someone's body, it will hurt. And so we know that there will be pain. But there are also things that calming techniques and things that people can do. So if you give us your contact information, we can give you some links that you can share with your parents so they know what to do when they take their babies into the doctor. And then one other thing, just more anecdotally, I'm a pediatrician, and I was for many years in a hospital setting and then in a private practice where I saw many children get sick with diseases like measles, like meningitis, like chickenpox. And when I became a mother, I couldn't wait for my children, who are now 14 and 9, to get immunized, because I knew that even though the pain of the vaccine, there would be some pain associated with it, I knew that those diseases were so horrific that I did not want my children to get those diseases. So I was looking forward to them getting the shots, and after every visit where they got shots, I kind of sighed with relief. They're better protected now, and they're less likely to get these serious diseases. So even though there was a potential for a sore arm or a sore leg, I would much rather them have that and to cry for 20 minutes or half an hour or at most, which it never really was, than to have those horrible, horrible diseases. So I think that that's one thing that's really important that needs to be communicated. And then, again, we really want to give you those resources so you can share those things that people can do to minimize the pain. One of the things, and then to answer your question to start to, because I know Dr. Perez has a lot more to offer than I on this topic, but the health department has worked for years with the Chicago Hispanic Health Coalition to try to work with addressing Hispanic family concerns about vaccines or myths and misunderstandings about vaccines, so we can try to address that. And so we have worked in partnership with them for many years to try to address some of those concerns. Because I think, and our goal isn't necessarily to stop people from doing things at home that they are comfortable with, but to recognize that there is a role for the immunizations as well.
Dr. Perez.
And on my way down, I just want to say that the Hispanic community is doing something right because they have the highest rates.
I think to illustrate the question that was asked regarding the beliefs and cultural perceptions of the community, the Hispanic community, I think we can talk about the flu vaccine, which in my experience is the vaccine that has always some reluctance from parents. And I think
What's the name?
the flu vaccine, the influenza vaccine, the flu vaccine. I think it comes down to establishing a good rapport with the parent, because the belief in the community is that the flu vaccine will give them the flu. And what I think the association comes down is because the flu vaccine is given on the winter season, which most of the time is when it happens, the colds and the influenza illnesses. So people, the community tend to associate because of they receive the flu vaccine, they get the flu. So that is the work that we as providers and educators need to break that myth. And parents, once they see the association, they tend to be very accepting of the flu vaccine. I know that also that's not the topic, but the other, and I think a provider, I could have seen this happening, how it evolves, and the role of the media on some vaccines. Perceptions is, for instance, the HPV vaccine, and this having a lot of controversy. There's still some misinformation out there. But I think once the information is released in the community, it acquires like a level of its own that we need to educate parents constantly about and need to be a resource for them.
We're going to have time at 11:30 where we're going to conclude and give you a chance to do one-on-one. But you're raising so many important issues. I do want to just quickly go through the rest of our media.
First of all, thank you all for inviting us and just sharing so much information. I have to be honest with you, as I sat here, I have a 16, almost 17-year-old son, and we never missed a beat in terms of his shots. But what you shared with me, what it revealed to me was my ignorance, because I never thought that parents weren't taking their kids. So I think that's a message that really needs to come across, because I'm sure I'm one of many who assume, now you never thought that it was 100%, but I never thought it was 74% either. And the fact that it wasn't done during the time that they tell you to go and get it is a concern that's definitely worth bringing up and shedding light to. I never thought that people waited until it was time for the kids to go to school, because that's when you have to prove that you've done it. And the importance of it, the fact that that's when children are most vulnerable. If there, I mean, obviously there's people that are doing that, but I think if they knew the risk that they were taking, I mean, what a message to really get across, because that's something that me personally, I never even thought about. And I thought about some of the people that have been coughing at work. Now I'm going back and ask everyone, have your child been immunized? And at what age, you know? It makes me pose those questions. I never thought to ask my sister.
That's so helpful. You know, the word that the CDC gave me, which has been the one I've used in my own office to make sure my staff has their children, is that they have to be the cocoon.
Absolutely.
So the cocoon concept is so powerful, because you may not feel you need to do it for yourself,
right,
but if it's you protecting the old person or the infant, then it becomes a moral obligation.
Absolutely.
Instead of a lifestyle choice.
Absolutely.
Okay.
Can I just ask one other
Yes,
question?
please.
When I thought about, you asked in terms of the community and the ethnic groups, do you think cost plays a part in this? But I have insurance, and when my husband, he's retired now, but he also had insurance. For those that are in between the WIC program and, you know what I'm saying, in terms of the private insurance, do you think that plays a role in the reason why some people aren't getting it done?
There is a group of people that's considered underinsured, so they have insurance, but their insurance doesn't cover vaccines or doesn't cover them completely. Those people can actually go to get vaccines for their children at federally qualified health centers, and that's through the Vaccines for Children program. So there are vaccines that are available for those children, but I do believe that there is a lack of awareness of the availability of that program, and so I think that there may be some people that are slipping through the cracks. So some of that may actually exist. I think with the Affordable Care Act and health care reform, that insurance companies will be required to cover the costs of all routinely recommended vaccines, and so the number of people who are underinsured should decrease over time, and children should have access routinely. So I think that may be an issue right now, but I'm hopeful that as the Affordable Care Act kicks in and things start progressing, that we will actually have fewer and fewer of those people slipping through the cracks.
Just because I want to make sure we get comments from everybody, I'll go right to Wally.
Okay, hi guys. My name is Wally Idris, the publisher of Africa US Today magazine in Chicago. Thank you guys for coming again to share this information with us, just like you did last year. The information you shared last year really benefited my community particularly. First of all, let me borrow this quotation from Dr. Kroger that says, vaccine is a threshold for safety. That quotation really applied to me personally. Because when I came to this country 32 years ago in 1980, and I don't know if I should be proud to say that I've only got vaccine one time in my life. Because before you come to this country, you have to get vaccine, against all this malaria, fever, and stuff like that. Since then, I've always go to a doctor, maybe once a year to get checkup, and they never find anything. Except when they talk about TB, tuberculosis, you have to get that shot. And people from Africa, especially, when you get that shot, there'll be a little swelling up in your veins. Sometimes you get so nervous, so paranoid, why? Did I get, I've been so good, why did I get, TB? But you will know that it's because you got that vaccination from your country. It doesn't really mean that you have that TB. So, having said that, now my question is, in America here, do these parents have to get their babies vaccinated only once, before they reach 2 years old, like you said? Do they have to get vaccination one time in their life, or do they have to get it consistently every year? I'm not very naive about that. That's why I need to
but
figure
that's
out.
very, very important. Yes,
The answer is it varies by the particular vaccine preventable disease. The timing of the recommendation for the doses is based on the age at which you're at risk for that disease or from the complications of the disease. So there are certain diseases like rotavirus for which we recommend vaccination in infancy. And then we, at 8 months of age, we no longer recommend that vaccine anymore. It's because the risk really has diminished. People have the disease. They have not. If they didn't get the vaccine, they had the disease. They suffered from the disease. Hopefully, they survived the disease. And if they do, they'll have natural immunity. Okay, vaccines provide that type of protection without having the person go through the disease. So that's one example. Then there are other diseases like influenza, which is another viral infection like rotavirus, but one that changes constantly. And because it changes constantly, you need to be vaccinated for that to prevent that particular disease, or to at least mitigate the complications from the disease every year, your whole life. Basically, starting at 6 months. So it varies somewhat by the type of disease, how we recommend these vaccines. So, and as for adult vaccination, we've got some work to do in terms of getting the message out for adult vaccination. Influenza is one that's very, very important vaccination to prevent Tetanus and pertussis is another vaccine that's required continually throughout adulthood. We haven't talked about other adult vaccines, of course. Today it's off topic, but HPV is another adult vaccine. Pneumococcal vaccines also exist for adults as well. There's a zoster vaccine, which prevents shingles, a complication from chickenpox. So there are adult recommendations as well. And healthcare departments and CDC have a schedule, both for providers and for patients, that kind of lay out what those particular diseases and those vaccines are.
Anybody else?
I just have a quick one.
I think the schedule idea is something we don't know enough about.
I don't know. So one quick question, or one quick comment. We've been talking a lot about children needing to get their immunizations before they're 2, and I think that's a very important. That's on time. That's when they should get it optimally. But if there's children who are older than 2 who haven't been fully immunized, it's not too late. They should get immunized, because I don't want people to walk away from here believing that if you haven't gotten your shots by the time you're 2, that you just don't need to do it. The message is really optimally we get them before 2, but if you don't get them by 2, please get them immunized as soon as you can.
Is there a schedule in the packet? Okay. So you'll take a look at that.
Very important, Wally, to look at the schedule in the packet. We have time, unfortunately, only for very quick comments, but I do want to give 300 media. Anything you want to add to the general understanding of misperceptions, myths we have to overcome in our communities?
Well, first of all, I want to ask if there's a place where you can look at the data, like the percentage of things that you guys were kind of starting off, if there's a site for that. I'm just wondering, I know, like, I feel like my generation is like pretty well educated in terms of like getting immunization. I know I got all mine when I was little, so I'm wondering if you guys have any particular programs aimed at like younger parents. Is that like an issue for them, or are they pretty good about like getting their kids immunized early on?
As far as the question about where you can find information in terms of data, and I guess in terms of different types of information, coverage levels, it would be the www.cdc.gov/vaccines site. There's several places you can click on, providers, patients. There's one for public health. I think the best source to get the type of data on coverage is to click on the public health link. If you click there, that will kind of lead you in the direction of, and look for links that say data, and you'll be able to find coverage data on our website. The most extensive data is from the National Immunization Survey that we do. And I'm going to, as far as parents and the age of the parents, there's been a lot of discussion about generational issues. Is there a better way to communicate with parents from certain generations about the importance of vaccination? So the fact that we have these different messages suggests that we have these groups have different needs. I don't know specifically what the formative research has shown. I don't know if others might be able to contribute to that in terms of that. My impression is, though, that it is kind of a very different message that we have to get out, especially because of the fact that the younger the parent, the less likely that they've seen the disease. And I think that might be a huge issue, is that the risk-benefit calculus or the equation is skewed. They don't know about the danger of the disease, so they don't understand the benefit of the immunization.
I think that we're always looking at the message and looking at the parents that we're trying to serve, annually. And so I think we look at age as one of the issues. I also want to say, though, I think it's the age of the physicians that also makes a difference. And I think that was hit upon here. And I want to say that the Illinois chapter of the Academy of Pediatrics has done a really good job of trying to focus in on those physicians that have not seen these diseases and to work with them.
Your text for baby seems particularly geared to the young mobile user parent generation. So last year.
I don't know that I have too much to add. I just appreciate you kind of giving us this briefing on this issue and more information about the campaign.
Do you have any personal questions? Imagine having these great experts here. We never get this many to take our kids.
Yeah, I don't have kids yet, so I just haven't thought about it.
But good.
But
this
I am fully vaccinated.
This will make it more. Okay, and finally, do you have thoughts about your audience and their issues about vaccination?
Well, this is like everybody covered the important question, but this is my silly question, but like I'm just curious. It's like there's lots of databases on CDC or your organization, but the most strong impact for me was the movie Contagious. So I was wondering, after that movie released, was the vaccination rate has an increase?
Yeah.
I don't think that's an interesting question. I don't think we've studied that specifically. It generated a lot of discussion even within CDC, and CDC was involved in a lot of the production aspects of that movie as well. So,
You were advisors.
correct.
Yeah, one of the things I wondered about when I saw that movie was whether or not the nasal flu vaccine would become more popular, because in the movie, the vaccine that's produced is actually a nasal flu vaccine, not an injection form. And to me, it made it seem less novel and less of a new concept. So I'll be interested to see how uptake of that product was this year. So I think it's a good question. But what it does, though, is kind of highlight the role that media can play potentially play in terms of improving public health practices and accomplishments. So.
I want to thank all of the healthcare providers who came to today's discussion. Any one of you have a final thought or a personal experience you want to share with our media, our message? Otherwise, just yes.
I think I work pretty much with the outreach with the community base. And I think media plays a major role in what the parents think sometimes. I mean, they rely on the physician to get rid of that myth. But, I mean, even when we were giving the shots and they said they gave the shot on YouTube and somebody was walking backwards, it took a lot for us to go back out there and try to get rid of that myth when you're coming to a community base. So I think what you put out there is almost just as important as what the provider is saying. So it's very important that message, that there's a lot to support it, that you give the resources, that if you put something out there that you hear, that you also back it up with the resources from CDC to kind of help support the parents, because they run with anything negative, it becomes a big deal for us to kind of come back in and try to get their trust back, because they do rely on TV and YouTube and music to educate.
You're a key source for media to go to get that kind of firsthand experience of, and I also deeply, deeply appreciate the media who came today. We have to say all of our media across the media sector, as you know, it's a very fragmented sector now. There is no Walter Cronkite, unless it's Mr. Ramos of Univision. And we are all doing a lot more with a lot less. So for you to give us a couple of hours this morning, we're extremely grateful. And you are the trusted communicators. Our polling has found that active doctors, people who are in the audiences of that media, look for health information to the media. So let's give our presenters a hand.